Thank you. Welcome, everyone. I am very happy to be here at the Pittsburgh Racial Justice Summit. I have been following the summit since 2014 or so. I've been in Pittsburgh for about 11 years. And so I'm excited to be here with folks who have attended lots of summits and others who maybe are new. My name is Anupama Jain. People call me Anu or Dr. Jain. And I want to tell you the story of Pittsburgh's inequality across gender and race, a report that came out in 2019. I want to use it as a case study to talk about how to go from identifying racial inequalities that are currently existing, getting reliable data, and moving from that to solving the problems that people face due to racism and other intersecting identities. I am one of fewer than a dozen people in the city of Pittsburgh or anywhere who saw this report from its inception as an idea funded by city government to a report that was released. And it's a report that we can all use as a tool to push public policy in the direction of greater racial equity. So we have a lot of pieces that we can work together collectively across our different identities to try and make actual change. And so I'm going to talk through the report, and I'm going to then ask you to pick one of the recommended action items that were based on the findings of the report. And then I'm going to invite you to actively choose an action area and think about how you can be part of solving these documented inequalities. And I'll tell you a little bit about myself just so you have context. And I will say one last thing as framework, which is we live in the age of fake news. I have been a researcher for quite some time. I was a professor for quite a long time. And I run a diversity and inclusion consulting company. And I want you to remember my affiliation with Inclusive because I am no longer the inaugural executive director for Pittsburgh's Gender Equity Commission. So this was a brand new commission where Pittsburgh was one of only 6 cities at the time in 2016 who created a body that would be shaped by local residents, citizens, people who are on the ground to help city employees to start to chip away at all of the different ways that racial injustice and gender injustice show up. What people often don't understand, not only was Pittsburgh a pioneer by creating this commission, we had the most progressive law in the country. And as far as I know, no city or body or municipality has passed such an ordinance requiring an intersectional analysis. So one of the things that has been challenging in the history of the United States and political activism is separation of oppression. So that there was a movement for racial equity and there was a movement for gender equity, and they took center stage at various times. But there have been historical choices made, for example, during the civil rights movement, to prioritize either gender or racial injustice. What the Gender Equity Commission does is it operates functionally in a way really different than the rest of American government. And this goes back to Kimberly Crenshaw's groundbreaking use of the term intersectionality in the late 1980s. And what Crenshaw recognized, and this is still true in the United States, that if you seek justice in our legal system, you have to pick an identity. Are you oppressed because of race, gender, religion, ability, veteran status, you name it? And the problem is none of us live single issue lives. If I can have the first slide, please. I have lovely helpers today. I want to thank Leslie. And I just had a blank. I'm sorry, I'm forgetting our co-host name, and I'm going to look for it in a second. Maggie and Lori are very helpful today. So what I want to start with is the first slide. If we can go to the first slide, please. We're on the third slide right now. Thank you. So here is my contact information at the top. And I apologize for any issues with how you see the slides. But the first thing I want to talk about, as I said, is intersectionality. So this is obviously central to this year's summit, and this is very important to understand, and people use it in different manners. So I just want to go back to the Kimberly Crenshaw use, emerging out of critical race theory, which is something that is in the news now, but critical race theory has decades of history, a lot of people of color, a lot of women really looking at how the law reinforces oppression rather than leading to equality. So intersectionality recognizes overlapping or intersectional social identities and related systems of oppression, domination, or discrimination. This is the box at the left that you can see here about intersectionality, just to make sure that when you're listening to me speak, that you're thinking in these guiding principles, because otherwise it really won't make a great deal of sense to understand this report and to sort of weed through the fake news that may be out there. So the other thing is, what is the difference between equality and equity? And equity is a term that's already been co-opted by corporate America and capitalized interest. So I think we need to keep thinking back to justice, but let's talk about equity. Equality, and this is a very, very familiar image to many people. Equality is, let's treat everyone the same. That's the only way we can have a fair society. Equity recognizes that we have histories of inequality, and we can't simply act as if we start with a clean slate. So equity says, recognize what people are. Thank you for the invitation to slow down. I apologize. Once I get excited, I talk quickly. Thank you, Deja, very much. So equality, to go back and to become a little slower, equality assumes if you give everyone the same exact thing, that the outcome will be fair. Equity assumes that people have different needs, different historical realities, and these social identities overdetermine our future. So statistically, we know in the United States that some people have life expectancy that is years longer than other people based on their race and their gender, based on their zip code. So we can't treat equality as if we live in a social vacuum. We have to focus on equity. So the thing about equity is we have to have both the lived experience directly told to us from those people who are experiencing oppressive systems. So we need to hear from those who are not the majority, who are not the people in power. In terms of race, in America, this is people who can participate in the power structures of whiteness. And in terms of gender, clearly we still have, by every statistical measure, being female, categorized as female in the United States, your social outcomes will be lower than if you were to be male. And so equity really is a reframing, and it's crucial because it's not about competition between individual people. The goal is collective justice. Sometimes collective justice doesn't actually benefit me if I see it as a loss. So it's important to think about equity as collective gain and not as loss. And so when you look at targeted universalism, for me, this is a very helpful way to think about how to collectively work together for future justice, both in terms of race and gender, but also in terms of heritage, language, religion, education, what we amorphously call class, age. So all of these things are constantly being implicated in our legal and institutional systems. Targeted universalism says we have to really find out who is statistically, structurally facing obstacles to equality and justice, and we have to uplift those people. So it is not that there are poor people in the United States. Obviously, factually, there are. It is that people have been systematically impoverished based on ability, based on race, based on gender. And there are many more identities. And here, these are some of the biggest that have structured American legal systems since the beginning. And of course, we're dealing with hundreds of years of law that was at its core ableist, racist, sexist, and homophobic, anti-trans. So all of these things are tied into each other. They are not singular. And so targeted universalism means we need to understand who are most impoverished by our collective systems, where our resources, our shared resources, are being hoarded by some groups and not shared. And over generations, this leads to structures that are very hard for people. It is very expensive to be poor, as Brian Stevenson has said, that our society really benefits people who already have access to resources and wealth. And then when you start to look at intersectional identities, you're seeing that most people are actually impoverished. And when I say this, can we go to the next slide, please? So this is data. This is about the most current data. And this report is 95 pages long. I have read this report many, many times. It is a hard report to read because in an age of COVID, we know that people are suffering. What this report showed us the year before COVID in 2019 is that many people were already suffering. And so COVID has only furthered the burden on individual people of a societal failure to enrich all of us. And so there is, as many of you know, an idea that Pittsburgh is the most livable city in the country. And that's based on specific analyses and algorithms. They have to do with the price of a home ownership. They have to do with safety, the number of parks, etc. So livability on one hand is something that Pittsburgh indexes high on. The reality is for many people, especially BIPOC people, especially people with disabilities, especially trans people, especially other people who are stigmatized and excluded from power, that they have not found the city as livable as claimed. So the report tracks the data that was publicly available, and there were challenges to that, and we can talk about it later, but it tracked as well as we could with the tools we had. And this is a report that should be redone every 5 years. And it should be redone differently to make up for some of the failures. But what it really showed us is it highlighted the 10 areas where people are having the hardest challenges and access to true livability. And the 10 things they came up with are listed here. I will just read them quickly so everyone knows. So these are the areas that we know systematically, structurally, there is injustice and inequality. And we know which groups are most impacted. So maternal mortality is one of the highest differences and oppressive systems in Pittsburgh. So maternal mortality for Black women is unconscionable. And we know through this report that this is something linked specifically to the choices made by our society, by our city, about where resources go, how we criminalize different things, and the stereotypes we use to blame victims for impoverishing systems. And so one is maternal mortality for Black women. Two, low rates in the labor force for Black women. Number three, occupational segregation for Black men. Number four, poverty for Black children and Black women. Number five, homicide for Black men. Number six, tobacco-related deaths for Black women. Number seven, cancer for Black men. Number eight, low college admissions tests for all students. Number nine, low average income for Black men. Number 10, cardiovascular disease for Black men. So what we see here is Pittsburgh's Black communities have been systematically excluded from the kinds of renaissance or rejuvenation that exists in Pittsburgh. This is not to say every person from any racial group will experience this. This is to say that the data tells us, predicts for us, that if things continue as they are, what we're seeing is the impact on those who are most vulnerable to inequality and injustice because of the history of United States institutions and white supremacy and sexism and homophobia and transphobia. And once again, all of these things are always acting simultaneously. Targeted universalism says, okay, where are we going to go in and make changes? Now, before I go in and move towards where public policy, where all of us who may not work for cities, who don't work for the government, who don't work in public policy, what can we do as action items to improve this? But before I move to that, this is a snapshot of a very complicated set of things affecting hundreds of thousands of people in, and I'm just talking about the city of Pittsburgh right now, but the region, the country, the world. And when you look at these hard truths about livability, these are all avoidable. That is what is important about these indicators. These are the things that public policy changes in the law will affect. So we need to all be educated about the complicated histories of poverty, of health, socially determined health outcomes that are quite unequal. And we need to understand those. But we also here, right here, have outlined what are the biggest problems that are hardest hitting. And this is before COVID. So we know most of these things have gotten worse, not better, right? But I want to zoom out and point out that we're all in Black Pittsburgh, multiracial Pittsburgh, women in Pittsburgh. None of us will succeed unless we realize that Pittsburgh has higher poverty rates than average cities. So even white men who are doing the best in Pittsburgh, they are not doing as well as white men in other cities. So everyone in Pittsburgh benefits. If we take a targeted universalist approach, we identify which of these areas we're going to make change in, and we work on those changes. Now, in yellow are things that city government can change. They are specifically things that laws, partnerships, collaborations, public-private initiatives, all of these things can help with. What is not outlined in yellow on your screen are things that the city actually has no legislative direct authority. They can advocate, and I think it's crucial to advocate, but the laws are governed at county, state, and federal levels for many of these things. So that's why they're not highlighted. I think they're crucial. And I know that the report has led to millions of dollars being spent on number one, maternal mortality. This is long overdue. People have known for decades about the high maternal mortality for Black women, and it is way past time that we hold all of our elected officials responsible for telling us what is happening, measuring improvement, because the only way we will make Pittsburgh livable is if we identify what is preventing equality and justice, and we change that, right? And maternal mortality is something that all of us need to be concerned about. We need to be asking questions about, because this is unacceptable, simply. Once again, the city does not have legislative power to do this. So homicide, and we have a new office in the city, the Office of Community Health and Safety, to take a different tack towards so-called violence like homicide, and to really understand the social determinants and impoverishment of all Pittsburghers leading to violence. So that's something, once again, that we can't deal with on the city level. Same with number 6, number 7, number 10. I want to mention number 8, because low college admissions tests, once again, all students in Pittsburgh, everyone in Pittsburgh benefits from us improving in these areas. But number 2, number 3, number 4, and number 9, we can all lobby our local legislators and make sure that when they pass laws, they are focusing on these things, right? They're focusing on the things that local laws will dramatically impact and show improvement. If I can go to the 3rd slide, please. So this is
may I also point out that you have a question in the chat from Celeste.
Thank you. Let me look. I appreciate that very much. Someone said disability. Thank you, Jennifer Jordan. I am trying to make sure that I name all the different kinds of intersectional identities. And so thank you for reminding us. Can changing laws be enough? What about enforcement and punishments for not following the laws that are near? Celeste, that's a really great question. And I'm going to suggest that that be a topic of the breakout groups. So we will be moving pretty shortly. So I wanted, this is not my usual way of presenting, but I wanted to start just by talking to you all, because I wanted to cut through some of the misinformation that is out there. And there are flaws with this report, but this is a powerful tool. It is in the public. No one has to do anything except go online, and I will share these slides with you. But all of this information is online at the City of Pittsburgh government web pages. If you go to a search engine and type in Gender Equity Commission and look for this report, Building an Equitable New Normal, Responding to Crises of Racist Violence in COVID-19. So there was a lot of necessary attention when the report came out in 2019. It was also tragic and re-traumatizing to have people's lived experiences of racist violence. And I'm calling racist violence both what we saw on a national scale that led to the biggest coalition that this world has ever seen for Black Lives Matter. This is happening in the summer of June 2020. It took 9 months to take the report and figure out how to implement these recommendations. So these recommendations on the page that I'm showing you, once again, these are on the web, available for everyone. This is just a summary. This report has details, links to ways that everyone in every organization, in every business, in every moment of their lives, how you can help us get to racial and gender equity. And so the first 4 are things that the city, once again, city government can't handle. That doesn't mean all of us can't work on them, but just I focus once again on 5 to 10, which we know from all the research and the way the research was done, that if we as a city can pass local laws to do 5 through 10, we will be improving the life of individual Pittsburghers, starting with those most vulnerable to racial and gender inequality because of our systems that reinforce it. Now, I want to point one thing out before we start to transition to what you all want to talk about, because the goal of this workshop is information sharing, overview and context about this report that there's been a lot of misunderstanding about. But I want to point out number 11, and I want to encourage everyone who's here to be paying attention to the ACE program. ACE is the Universal Basic Income Program, started in Pittsburgh last year. And the challenge of universal basic income is, once again, lots of fake information, fake news. But I have been a proponent of universal basic income for 20 years. And this building an equitable new normal gives you lots of information, lots of research, lots of sources. And so the universal basic income program in Pittsburgh is nothing short of revolutionary. We are giving poor people money because people who have been impoverished by our society, by our laws, by racism and sexism and implicit bias in daily practice by people in power, poor people do not need a helping hand. They do not need lectures on their work ethic. They need money. And piloting this program is really, really useful as an example, because I think Pittsburgh is probably the perfect city to show that we can give everyone in the city money and they will reinvest it in our economy. What everything that I've ever read suggests is when we have people who have financial stability, who know that they are not going to have to struggle, that they're not going to have to see health degraded in their families, violence, the microaggressions that actually have negative health effects on people. Everyone in Pittsburgh should partake of the money that's in Pittsburgh. And so piloting a universal basic income program, 200 people were given 2 years of money to then hopefully pull themselves up by their bootstraps. And if we see what we see in other parts of the world, this will enrich everyone's life in Pittsburgh by revitalizing the local economy. So the universal basic income program in 10 years might actually be the way to get us towards an equitable new normal in our city. And we can be a beacon to people elsewhere. So I'd encourage everyone to follow up on the ACE program. There hasn't been any updates. We have a mayoral transition happening. They will need to fill the position that I used to hold. I really think if we have someone who is a lifetime of experience in Pittsburgh, history in Black Pittsburgh, of community building, everyone at the summit who's been part of the summit for years, Tim Stevens, all of these folks have helped us get to the place where we can really install a powerful leader to lead the Gender Equity Commission into the future and make sure universal basic income is not lost on us, because it's something that capitalism hates, the idea that we could just give people money. But let's just do it. Let's do it for peace. Let's do it for financial revitalization. Let's do it for innovation. So those are the outside things. 1 to 4 and 11 are things I encourage people to think about. For the purposes of this workshop, we're only going to be talking about the things in the yellow box. And we're only going to be talking about 4 of them. So in a moment, with the help of my wonderful Zoom hosts, Leslie and Maggie, we will be asking you which topic you want to talk about, and we will be dividing you into breakout groups for 10 minutes. And I'll give you some specific instructions, but I just want to talk through 5 through 10 for a second, and then we'll shut off the slides and move to the breakout room instructions. But the first thing I want to point out, and I mentioned Tim Stevens. Tim Stevens is one of the founders of the Black and White Union, and the Black and White Reunion has been hosting for over 20 years the Pittsburgh Racial Justice Summit. It used to be called the Summit Against Racism. And Tim Stevens has also been foundational to something called the Corporate Equity Inclusion Roundtable. And they are very committed to number 5, update the city's Rooney Rule with results to further equity goals in hiring and promotion. They have extensive white papers and blueprints for how to do this. So I encourage everyone interested in the Rooney Rule with results, which basically means using a homegrown Steelers model and updating it so that we can actually eradicate implicit bias where it starts, we know, in the employment sector with bias in hiring and promotions and structural barriers. So number 5 is something I encourage you to look up, find out more about Tim Stevens and CIR. Tim and many, many wonderful people have made the summit possible. and who made the Gender Equity Commission possible. And thank you. I see that someone, Michelle, yay, Michelle Abbott, so glad to hear from you about the ACE PGH program. And thank you for giving us your contact information. I no longer work for the city, so I'll remind you that I don't represent the city of Pittsburgh. I don't represent the mayor's office. I'm a citizen running my life, but I'm going to stop talking and switch to you talking. The goal is that you talk in small groups about some of these other recommendations. And we'll tell you what the breakout group possibilities are. And we're going to ask you to pick which one you want to talk about. They are hiring equity. So things like not asking about prior salaries. These are based on empirical data that when we do these things, when we stop pay salary, we eradicate certain kinds of gender-based inequality. And this is a message I'll leave you with before I continue with the breakout with, sorry. Brain going too fast, talking too fast. Let me go back to that. 4 breakout groups. One is going to be about hiring equity, how to get people hired, because we know low occupation and occupational segregation are huge things affecting especially Black men who are seeking jobs but not getting hired because of racism. And we know that the report makes it clear that this is why this is happening. It's racism, it's sexism, and they operate simultaneously, which means why we really, really need to not separate out and say, I'm only talking about race here, I'm only talking about gender here. So number 2 is paid sick and safe leave. And this is a very gendered issue. Hiring equity is gendered and race and LGBTQ+ status, disability status, pregnancy status, all of these things, biases come in and we find inequality heightened. So hiring equity is the first breakout group. The second one is pick sick and safe leave, because women still do the majority of caretaking. This is statistically proven. And women do not have the benefits in the occupations that they are usually in of sick or safe leave. And safe leave means women who need to get away from violent partners or acquaintances. And this is one of the biggest employment disruptions in women's lives. So of course, violence happens between other people, but the pernicious, ongoing, endless violence against people who are seen to be female and trans or non-binary, but especially if they're targeted because they are perceived as female. So gender-based violence cannot be separated from racial equity. It cannot be, because people are in the positions they're in and impoverished because of both identities as well as other ones. Number 3 is early childhood education. You hear this cliche, we have to start as early as possible, because we are finding that people's psyches are traumatized and re-traumatized because they live in racist, sexist societies. So we need to start with early childhood education and funding it and making it high quality. There are a lot of women running informal childcare networks because the systems that our government has supported have been completely inadequate. We don't need to start from scratch. Every developed country but the United States has figured out childcare, and early childhood education is a key part of that. So that's one area to talk about. And the 4th is supporting women's businesses. This is something people say all the time. I do not find it true in practice. I do not find men supporting women's businesses in practice in local government. I find the same old ideas and tools that are decades out of date. So innovation is going to be improved if we support women's businesses, but we have to innovate before we do this. So those are the 4 groups, and I'd like to turn it over to Leslie and Maggie, because I think they're the folks who are going to help us with the breakout rooms. But what you want to think about, and there will be a poll, I believe, Maggie, if you want to take a moment longer to think about which breakout group you'd like to be part of.
Okay, hi everyone, this is Maggie. I just wanted to help a little bit with the logistics of breakout rooms. First, I just launched a poll that shows the 4 options that are available. This poll is to help us see how many people are interested in which room, to make sure that we don't have, 100 people in one room and 2 in the other. And then after that, there will be breakout rooms launched where you can select which room you want to go in. If you require ASL interpretation, feel free to drop that in the chat or go on video to make sure that one of the interpreters can go with you into the correct video room.
So why don't we also take some time for questions and give people a chance to put themselves in the breakout room? Breakout rooms, yes. And remember, in the breakout rooms, before I see if people have questions or comments, and if you want to make a comment, you can raise your hand. And we are going to be very careful. The goal here is building community and finding ways we can collectively make changes for greater equality. So we ask everyone to stay, community oriented and not harass each other. The Zoom bombing is a thing. But so we ask if you want to, you can put it in the chat to everyone, or you can raise your hand if you have a comment while we get folks sorted into breakout groups. I'm noticing supporting local women-owned businesses might be the smallest group, and I wonder if those folks will stay in the main group, if that's okay. Please take a moment if you want to join a breakout room. The idea is that you'll spend 10 minutes, and I'd like you to come up with 3 ways that you as a group think could actually make a change in these, in your chosen action item. And you will inevitably find that because of intersectionality, everything is going to overlap with everything else. This is a chance to really focus. So if you really care about health and you wonder why that's not on here, safe leave and sick leave are very directly tied to health. So think about what you know about the systems. Thank you for the CEIR contacts in the chat, but that really the purpose here is to get everyone on the same track so that we might come up with new, better ways to actually move to change. And education is never going to be unimportant, but here we're brainstorming and trying to get action oriented. Any questions? People are dropping contact information for organizations like CEIR, that's the Corporate Equity Inclusion Roundtable, if you're interested in the Rooney Rule with results. Anyone else want to share a group or contact, please send it to the summit, info@pittsburghracialsummit.org. It looks like everyone has picked a room. Maggie, can people go ahead into their room?
Yeah, the rooms are now open. If you use a computer, on the bottom row of your screen, there should be a breakout room button, I believe. If you click that, it will let you pick which number you'd like to join.
If people want to be assigned to a room, let us know.
Yeah, if you're not sure how to do that, feel free to put in the chat which number you'd like, and I can put you in that room.
And if other people aren't picking a room yet, why don't we go ahead and actually just have folks go into room for supporting local women-owned businesses, and then I'll stay in the main room for folks who might want to chat more generally or. Thank you. So we're just figuring out the breakout rooms. 10 minutes of discussion where you're trying to come up with up to 3 concrete ways that your organization, your employer, ways to encourage local legislation, federal legislation. So what what knowledge you have, that is what you can bring here to collectively trying to come up with action items to take away. And if anyone has questions about the report, if I spoke too quickly, which I'm very prone to do, please let me know. You can drop something in the chat, you can raise your hand. And for folks who haven't picked a room, we can start assigning people randomly to rooms, unless you indicate you want to stay in the main room. And the breakout room should close in 10 minutes, I believe, Maggie.
Sure, yeah.
Sure. So about should we say 10:35?
10:45 sounds fine.
Okay, that's like
Oh, sorry.
Or 10:35, but that's closer to 10 minutes.
Okay, so let's do 10:40.
Okay.
10:40, and you all are mostly in rooms. I see it happening slowly. Thank you, Maggie. The reminder of what the breakout groups are, and they're based on the poll as well, if you are trying to navigate. Give us a shout out in some way if you need any kind of assistance. It looks like most people have gotten into rooms.
Anu, it's a chunk of the people here are the ASL interpreters who will be staying here. Another chunk,
Okay.
it's safe to assume some people are not sure how to use breakout rooms or
Right.
are sort of, listening while driving or something.
Yep.
If you want to join them, you can also jump between the rooms if you would like.
Yeah, maybe I'll join room 4 because it's a small group, and then I'll come back.
Do you need to be moved there, Anu, or can you handle?
I think I can join.
Okay,
Thank
good.
you. So someone in my breakout room, which I got very passionately excited about because it was women who want to support, or people who want to support women-owned businesses. And I think that I'm not sure how to make common cause. And that's partly what motivated me to do this workshop. That I think a lot of people in Pittsburgh passionately care about racial and gender equity, but most of us are working in our silos always. And I don't know what will happen. The summit is so important. At least once every year we come together, hopefully get rejuvenated. Tao was mentioning Prototype as an example of a women-owned business. Tao, do you want to unmute yourself if you can and tell us about it? Prototype, if you're willing.
Yes, I was really inspired when they saw them because, as you know, maker spaces are typically just white dudes. And so the point of Prototype was that we are explicitly gender inclusive, and we want to make sure that everyone knows you can come here and you can make stuff. And so they've also set up an incubator program where they're trying to support other women who are trying to make their own businesses. They're like, we all identify as women, and we're all searching for power. And so we want to share our power and our resources to help each other get our businesses off the ground.
Cal, thank you, because that is, so to go back to the guiding principles, targeted universalism says until we help those most impoverished by these sexist, racist, and other systems, we will all be suffering, right? It's about that collective power. And that what I see is a lot of people fighting for justice with a small group of people and not asking, how can I share this power? And so Prototype, I'm a member, so I'm biased, but Prototype is absolutely a very concrete thing that I encourage everyone who wants to support women-owned businesses. Now, don't only support Prototype. You don't have to pick one. Pick every organization, but that is one that is committed to helping women grow businesses, sustain them, and they're meeting people where they are. Some people need a space literally to even be and make anything, right? And so Prototype is a fantastic homegrown local version. And so I really appreciate that. But supporting women's businesses means stop thinking about it as women's businesses and think about it as we need our society to thrive. And when women's businesses are treated as unimportant, when women are more than half the population, and when we know racism means that in particular brilliant ideas by Black women are not getting to the forefront, all of us are suffering. Brilliant ideas that women have for businesses are being squashed. And I tell you this because I talk to male funders all the time who have no interest in women-owned businesses. They think these are something unimportant. This is where wellness is happening. This is where innovation is happening. This is where design for ability and disability is happening. So these are what, in the crisis of COVID, countries run by women did better. They thrived. And I'm getting passionate because sexism is so embedded in our systems that I am frustrated when people think it's fair. Racism and sexism will make your life shorter. If you are a Black woman, if you are a member of a historically Black community in Pittsburgh, I come from an immigrant family. We were poor, but we also got benefits from the government. My family was helped to buy a house in the 1980s. I was helped to buy a house as a young, single working woman. Those are things that were not offered to all Americans. Americans were systematically kept from those things, especially if they were Black. We haven't even talked about Indigenous people and how much they are excluded. And I purposely didn't talk about them because the numbers are so small in Pittsburgh. I'd rather that people who identify as Native American or Indigenous speak for themselves because there is not one general story. But what I'm saying is, if we don't collectively work against racism and sexism and homophobia and transphobia, which are all intersecting all the time, and which our legal system fundamentally does not promote equity for. If we can't work together, all we're doing is we are encouraging the silos that say, it's either mine or it's yours and you're my enemy. Scarcity mentality has made people think, I cannot work with anyone else. I cannot share what I know. I cannot share my resources. And so I'd like to hear from other groups, but I wanted to just get really passionate for a second. I was starting with data. What an unarguable fact. People can interpret the report differently. It shows racism and sexism are killing people. Now, that is important to me, and that is important to everyone in this room. Why can't we figure out how to make common cause? So can we share some action items from any of the breakout rooms? If you can raise your hand, put it in the chat. But, you know, I really want us to leave here with one concrete idea as a group that all of us, one thing you can do, hiring equity is look at the hiring practices where you work if you work. If you run a business, look at your hiring practices, eliminate bias. That's a huge thing everyone can do right away. But anyone from that breakout group want to share any suggestions you had? You can put them in the chat, you can raise your hand. And, you know, any of the groups. Hiring equity. Thank you, Martin, by the way. Any other groups you want people to know about? There are a lot of groups and a lot of people in this city who care passionately, but we're not always working together. So I'd like us to think, and once again, corporate equity inclusion roundtable is wonderful.
Hey, Anu, when there's
yes.
things in the chat, would you mind reading them out loud in full so that people that don't know the chat or can't see it understand what you're talking about?
Oh, of course. Thank you so much, Maggie, for the reminder. I wanted to read, I'll read a couple of things, but I really encourage people, if you had ideas, if you're working on something that you think other people can support, we need to work in coalition together. So here are some great suggestions. Michelle Abbott shared earlier in the chat that they're working with 1PGH to run the Universal Basic Income Program, which is called ACE-PGH. They haven't launched yet, still waiting for funding contracts to go through with the city, but hopefully soon. Also trying to create a coalition of folks interested in supporting guaranteed basic income in Pittsburgh. So I'd be happy to connect with anyone who wants to know more, collaborate. mabbott@onepgh.org. Okay, CEIR contact information via BPEP. That's the Corporate Equity Inclusion Roundtable, one of the best places to go to work on reducing things that are related to the workplace and equity issues. That's bpep.pittsburgh@gmail.com. And Martin shared, I recommend pittsburghunited.org if you want to engage campaigns on these issues. Thank you very much. There are lots of people working on this. paunited.org, wonderful organization to think about joining. Lori reminded us that at the end of the session, you can download the chat and save a transcript for yourself. A recording will be available at PRJS's website. Martin also shared SEIU and SEIU Healthcare and other unions, along with PittsburghUnited.org, just celebrated the victory of a new paid sick leave ordinance for Allegheny County. Thank you, Sabine, Peggy. Salary negotiation is important to help close the pay gap. AUW offers free online classes. Once again, if you go to pittsburghpa.gov and you look for the Gender Equity Commission, there are a lot of resources. The Gender Equity Commission partnered with AUW. Salary negotiation is super important. Sabine, if you know of any teens, women, femmes, gender expansive youth interested in advocating for issues like this, please share Girl Gov with them. We'd love to have more teens. Girl Gov is awesome, and I encourage you to think about them. Deja wrote Unite. We're a big fan of you, Girl Gov, and Sabine says, thank you. I love Girl Gov. Can't wait to see you. Unite is an organization founded by Summer Lee, one of our leading voices, youth activists, I guess not a youth, but much younger than me. Martin, there are now paid sick leave ordinances in Pittsburgh and Allegheny County, monitored and make sure these ordinances are implemented. Earl and Michelle is going to share early childhood care expansion solutions. So what I want to point out to you is that these are 4 areas that the report pointed out are affecting many people in Pittsburgh negatively. And they are areas that uniquely represent how gender and race and other inequalities work together. So when you think about hiring equity, that implicit bias is one of the largest barriers, as well as what they call, the old boys network. That the way that Americans live, their social segregation means that people are still choosing people just like them. So hiring bias is one of the biggest issues to work on. And I would encourage you to, once again, to start with, what does your employer do? Or what do you do? Paid sick and safe leave, I'll talk about in another moment, but early child care, one public policy thing you can keep track of is a quality fund. And this is money that is intended to be used for all of us. One of the things that happens with public policy, sometimes good laws are passed, but people aren't really tracking the implementation. So one thing that I would suggest as an action item is all of us seeing where this money is being used and diverted and keeping track. And public source is a great resource. I think the radio, creating the Confluence program, these are great ways to keep track of some of these things. The URL talking about universal basic income in Pittsburgh, Tao asked, sorry, just got really cold in my office. If the person who shared the ACE-PGH website could share it again. I wanted to continue reading. Celeste Taylor, One Hood Media has many opportunities to make progress fighting against white supremacy and advocating for justice. Support Women's Businesses was the group we started with. What I'd like to ask everyone to think about is how often do you do something that directly supports a women's business? How often do you pick a women-owned business versus a different one? And these are questions we can as individuals ask. And then, as I said, the URA, Chatham Center for Women's Entrepreneurship, these are places that we can all actually help women not only start, but sustain businesses. And I want to talk about paid sick and safe leave. And I mentioned how these were health issues, but did anyone have thoughts about how we can continue to support these? To describe paid safe leave for a moment, if anyone is unfamiliar, very few cities have this kind of law. Pittsburgh, the city of Pittsburgh government has this law, but we'd like to get private employers to really figure out systems. So what happens is women lose their livelihood because of gender-based violence, because someone who may be in a violent relationship to them knows where they work. And so it's not safe to go to work. And because women do most of the child rearing, they may lose their homes. And so this cycle towards poverty and vulnerability is one we're very conscious of, and it's been going on for generations. And so I think it's really important to think about things we might not think about, that because of gender-based violence that disproportionately, primarily affects women who take care of children, we're seeing societal fabric breakdown. So paid safe leave might not feel like an important thing, but it is a legislation that will directly save lives. It will save people's lives. So paid safe leave is not necessarily sexy or well known, but those are the kind of public policy things that I think we can all get better at promoting. Okay, so I would love to ask I have a couple more things to read from the chat. Childcare, and please raise your hand if you want to share other things, put them in the chat. We want to hear about solutions together so we can support each other and not be doing this alone. Michelle said, childcare, it sounds like the biggest barrier is funding, mostly decreasing subsidies from federal, state level. But locally, we talked about one, improving organizing the pipeline of childcare staff, including expanding the Jumpstart program through UPitt. So Jumpstart at Pitt, transportation subsidies for mothers is number 2, and number 3, unionizing childcare workers for better salaries. I love it. Those are really concrete things that I think could make a huge, huge difference in the lives, not only of individual children, whole families, and the fabric of our communities. Once again, I'll just repeat something really important, that livability for Pittsburgh, my livability depends on everyone else's livability, and I want everyone to have really high livability. My life will be more peaceful, there will be more creativity, more art, more innovation, more chances to build community. That's the Pittsburgh I want to live in. And so I think improving organizing the pipeline of childcare staff. I do want to point out that Mayor Gainey's office has a position that is budgeted for this year for an early child care manager. And so make sure that position is filled and make sure that the pipeline of childcare staff gets support. So that's something that you can already do. It's an ongoing initiative. I see, what was the second one? Transportation subsidies from others. This is another thing that women and men have patterns. And I don't believe in gender as a natural thing, but gender, like race, is socially constructed. And women are different than men in some ways, but the reality is how women and men have been shaped by our society, how women are so tied to caregiving. Men and women do not travel the same way, but most of our public transit is based on the lives of men. And so transportation subsidies for mothers, again, might seem like a small issue, but it's huge. How are we getting people, families, children, vulnerable people, older people, how are they getting around safely? And if in COVID, we're all isolated, we need to now come up with a plan for 5 years from now where people can safely get to where they need to go, that they are not choosing between housing and the cost of a car, because that's what impoverishment looks like based on racism, sexism, and all the other isms. And finally, unions. Americans bought a lot of propaganda during the Cold War that said unions are bad. Unions? What? An individual owner of a company is just going to be nice to me? Like, no one believes that. No one believes that. If the business is to make a profit, then that's the business, right? My business is not like that. It's a social enterprise, but that's what most businesses are. So we cannot count on employers to have our good outcomes in mind. And choosing that is a really bad option. So unions, if you have an anti-union bias, look up where unions do good and where they do bad, and really educate yourself, because the anti-union bias is really tiresome in America. And I would love a union for inclusion, because I know what makes for good business, and happy employees make for better business. So unions, thank you for childcare, Michelle. Unionizing all workers is going to lead to some unexpected outcomes, but it also leads to less poverty. Center for Women's Entrepreneurship. Maggie is also sharing the childcare initiative. This is new to me, lovely to hear about. It's in the chat. There's a link, chatham.edu, Center for Women's Entrepreneurship. We are a generation behind in coming up with childcare and early childhood education. Once again, compare us to every developing country in the world. They do not think of childcare as a personal, private issue, because they recognize if we don't take care of our children, there's no future, right? Total cliche. But our government and our public policy has acted like everyone should independently afford childcare. that has come at the detriment of young people, our most vulnerable. So I think absolutely anyone who doesn't prioritize childcare needs to do it now. I don't have children, never plan on having children. And I know this is one of the most crucial changes. And it is a cultural shift of changing what we were taught, that childcare is not something that the whole society should focus on, to something that we need to focus on. Jenny, the city paper started to support Black-owned businesses during the pandemic. I feel it's time for them to create the women-owned business women-owned business list. Jenny, thank you. That is a way. I also have a little secret about a way to support women-owned businesses. Is when you have a panel, say, you get business owners, pick women, just make them all women. How often do you see a panel of all men? All the time. So just make it all women. Those simple choices, when you promote women, especially when you promote Black women in Pittsburgh to talk about racial equality, you're doing the right thing. Trust women, trust Black women, trust people until they show you that they really aren't in it for justice. And at that point say, no, thank you. I'm going to support the women-owned businesses. But fire off an email to City Paper, like Jenny. Tell them to have a list of women-owned businesses. Michelle Abbott, website still under development for Universal Basic Income Program. Contact in the interim, mabbott@onepgh.org. So look at 1PGH, find out about the Universal Basic Income. This is like huge news that 200 people for 2 years in Pittsburgh will get monthly money with no strings attached. And they spent months figuring it out so that these people would not be further punished for this. 100 of those are Black women in Pittsburgh, because we know from the report that they are the most fundamentally blocked systematically from access to opportunities to true equity. So thank you, Michelle Abbott. Peggy Schmidecki, I apologize if I got that wrong. Pittsburgher CEDA, crucial, like New Voices Pittsburgh, like Women and Girls Foundation, to the creation of the Gender Equity Commission. Allegheny County Organization was very active in the forming of the Gender Equity Commission. We have a commissioner serving on the City of Pittsburgh Gender Equity Commission, Judy, also looking at Allegheny County Article 1016 Gender and Race Equity Audit. Get an audit, join us if you want to help get an audit done that is behind schedule. So that's also new information to, well, no, it's from 2009. So anyway, it looks like Allegheny County, I'm going to slow down again. I'm getting into my fast talking, I apologize. Allegheny County Article 1016 Gender and Race Equity Audit from 2009. We also have a state commission on women, and President Biden has created a gender equity department. So we have things happening to help support women-owned businesses and women in general, especially women of color, especially Black women in Pittsburgh.
Quick reminder, this workshop closes in 10 minutes. So people need to wrap up, sorry.
No, I'm heading towards wrap up. I'm reading the last few chat comments. Celeste says, Celeste Taylor, I appreciate the mention of dealing with the role of HR and bias. They can have a huge impact who gets interviewed, hired, and retained. We know that there is a bias against Black sounding names, hairstyles, and clothing. I would be interested in knowing about any ways to deal with HR folks. Thanks. Human resources corporatized diversity, and they used approaches that were unfortunately not grounded in research about human behavior, history, structural inequality. And so human resources is challenging. My experience of human resources is a lot of people who really care, but who don't have a lot of education in structural inequality and inequity. And so I do think in any circumstance, we have the opportunity, the Rooney Rule with results. The reason why CEIR, Corporate Equity and Inclusion Roundtable, so highly recommends it, and they totally persuaded me, is because It is a Steelers invention. There is no reason every employer in Pittsburgh should not use the Rooney Rule with results. And there's a blueprint in the Corporate Equity and Inclusion Roundtable. So let's get it in the hands of every employer and let's start asking why they're not getting rid of bias. And usually they'll say it's too complicated, it takes too much time, it's too expensive. Still worth it. It's the only way we're going to get to equity. So thank you, Celeste. Lori Mann, people over 65 can get a free PAT transit card for free transport, at least after morning rush hour and before afternoon rush hour. Yes, and that is, those are all good measures. I just think we need transit. Uber should be privately, publicly funded. I don't know. We just need to think outside the box. I think tweaks are not going to change the fact that our society is fundamentally structured for able-bodied, white, upper middle class people to have the most convenience. And that's pretty systematically clear, that we might have material comforts in our lives, but most Americans lead lives of incredible inconvenience because our social systems are based on these other things. But thank you, Lori, absolutely. Get a free PAT card. If you don't know about it, check it out. I noticed Randy was here from Age Friendly Pittsburgh. I think this is another thing that we all know, the boomers are aging population, but like I said, that everyone should support women-owned businesses, even if you don't own one and you're not a woman. But I also think that we all need to think about people of different ages and what their needs are. And disability is coming for all of us. And disability means our society disables us. It means that it makes it hard for people to navigate. Curb cuts are important, and we need to do that universal design to really think about how can people move in the world the way that they need to safely and easily without more obstacles. Martin Raffinen, home quit care workers. There's a URL, uhwp.org for home care workers. Okay, Peggy is clarified. Audit for gender pay equity in Allegheny County was last done in 2015, supposed to happen every 5 years. So that is another thing. I mean, you're all busy people. And so one of the things that I often encourage and try and practice myself is, how can I loop in the work that I have to do to live my life and make salary with work that's going to support the things I care about in terms of justice. And once again, part of what I think this report offers us is that it offers us really concrete action items that we need to do together. And so if in the last few minutes, if anyone has any thoughts about ways that we can help each other. So the Commission on Women at the state level, for instance, the executive director put out a weekly list of all of the laws in the Commonwealth of Pennsylvania affecting women. It's a long list, and I couldn't always look at everything, but it gave me a chance to get an overview. So I think if we can start to share information with each other about the ways that we're working on hiring equity, paid sick and safe leave, early childhood education, and supporting women's businesses, and stay the course. Because I think, once again, we may work together in short moments, and I'm so glad that the summit brings us together every year, but what happens between the summits? How do we sustain some of this energy? And there's the fake news I want to circle back to that I started with to leave this session. And I'm going to put my email in the chat for reaching out to me, because I do think of the summit as a chance to get energized, to learn new things. Thank you for everyone who shared things with me today. I learned a lot. I'm going to look at the chat, follow up on some of those things. And I just really want to stay connected with people who have the passion. And the important part for me is taking my individual situation, seeing how it ties to public policy. That means the attitudes that drive our laws. And so I need to confront my own attitudes. I need to keep learning. Intersectionality offers me a way of remembering that laws impact people differently based on their identities and the histories of inequality. And I don't know every story or every example of how inequality manifests, but I know some of the general patterns, and this report helps to focus us and say, what are the things we can do collectively that we know for a fact will make a change because they either made changes in other cities or they worked in Pittsburgh, or we pilot them like universal basic income. So we have to try new ideas. And I'm gonna ask you to do a short survey on this workshop. There is a URL in the chat that is too long for me to say, but I would like for you to go. And please, I have read the surveys in the past. They help improve future summits. I'm just so glad to reconnect with people, but I also want to suggest that as residents, the more that we can think back to heritage like Mr. Rogers and kindness and remembering that we're in this together, because I think in the daily challenges of all our lives, it's very easy to see each other as enemies. But I think we have systematic inequalities that we know how to fight if we can stay focused on the coalition. That it is in everyone's best interest for the future generations in the United States to experience equity and to thrive. I'm genuinely 100% convinced of that, and I've been studying gender and racial injustice for 30 years. So I've done a lot of reading and thinking, and I applaud all of you for coming to the summit. I thank you, and I encourage you to remember you're not alone, that there are many people in the city who are trying to fight against power and hoarding of resources and injustice that is disguised as other things. And so hold on to this report, share this report as much as you can, not to argue the details, because there are lots of flaws with any report, but look at the indicated items that will make a change, that individual people will see more access to opportunity and equity. And every suggestion that was made here is so helpful. Last comment in the chat, here in Westmoreland County, we have a movement, Voice of Westmoreland, that addresses all of these things and plans group actions, organization, focus groups. Thank you for mentioning Westmoreland County, because even in the city, we have our own things that are marginalized. And we have a lot of surrounding areas with a lot of poverty, and people struggling with the same issues that we're struggling with, but the context is different. So once again, we're in this together, and the summit persists, and I thank you all so much for being here. Have a great rest of your day.